People in our community living with mental health issues often feel isolated and alone because of social stigma and barriers to adequate support services. But all it takes is one connection with a quality mental health professional to transform a life. Now mental health professionals are working together with participants and advocates to improve mental health services across Massachusetts. Here are our stories.
The topic we're going to talk about today is the community-based flexible support system. This is a new service that was developed by the Department of Mental Health in 2008 and implemented last July.
It saddens me greatly to see all of the things that are going on and the basic human needs that are not being met through CBFS.
We've learned from case managers, mental health workers, advocates, and participants that there are many problems with this system.
People also lost their DMH case managers. So in a very short amount of time, people might have lost their direct advocate, their DMH case manager, and the entire agency that they had known to grow and work with. And some of these relationships have lasted for years and years. And all of that was wiped out, once again, more or less overnight.
So in July, when CBFS came into being, and it was DMH that deemed it that way, we were told that a lot of our clients we just would not be working with. It wasn't a matter of choice, it was a matter of we had to close them. We were given very small amounts of time to say goodbye to clients, and that was very difficult. It was very difficult on us, and it was very, very difficult on them.
For all CBFS participants who choose to, should have access to independent public case management throughout their recovery process. Meaningful and transparent accountability systems need to be put into place to monitor the quality of services. These are necessary to protect the participants and taxpayers, in order to reduce turnover and provide quality services. Mental health professionals need proper training. They need reasonable workloads and supports, and the administrative to direct care ratio and caseloads must be established and enforced.
Empower stands for Massachusetts People, Patients Organized for Wellness, Empowerment, and Rights. I've been involved with them for about a year and a half. They do both advocacy for better mental health treatment, but also kind of fighting the stigma of mental illness. We can reduce staff turnover, we can reduce staff burnout, and that in turn leads to the kind of like meaningful client-staff relationship that really fosters recovery.
I'm hopeful for the future because SEIU and Empower and other people are standing up now and trying to do something about it and have had some success.
I, as I said, have mental illness, depression, post-traumatic stress disorder, and I also have ovarian cancer. I know there's hope for people. With the right supports and services, with peers, with peer respites, with the right services, with enough money in the system, people get better, and then it costs everybody a lot less.